They knew my name when I walked in. How important is that in healthcare? It's incredibly important. I mean, we're comparing ourselves against Neiman Marcus and Nordstrom's and Disney. I don't know about you, but when I go to Disney, nobody asks me about, bowel habits or anything like that. I mean, I'm sharing some personal stuff. I want you to know my name. Read the chart before they come into the room? You mean like do their homework in advance? And why would you want to read the chart before they walk into the exam room? Right. So they're prepared, and then they have the time to interact directly. They're not looking down at the paper. So read the chart before they come into the door. All right, that's a pretty good list, isn't it? You've looked at what you want the patients to say about your organization, what you want the physicians to say about the organization, and what the employees say about the organization. Is that doable? What we just did is an exercise that is actually a precursor to a vision for your organization. I would encourage you to go back to your organizations and do the same thing. Everything speaks in your environment with every contact that you have with your patients. If everything speaks, what are you saying? Now, this is a funny story. I was doing some secret shopping, and I was in a radiology department, and the trash and the linen was just bulging out of these containers. And I said to the manager of the department, now, if I were coming in right now for a test, this is what I would see? And he said, well, it's 4:30. And okay, 4:30, I shouldn't expect a clean environment. And he was appalled when I said, wait a minute, so if I want a clean environment, tell me what time I should check in. Now, if everything speaks, what are you saying? And are you being consistent? We look at E to the third power in our organization. E to the third power, and it stands for every customer, every encounter, every day. And that's what you're striving for. I have found that working with physicians and healthcare professionals and practice managers and practice staff, that if I talk about patient satisfaction data to caregivers, oftentimes they get a little glazed over when you start running the numbers. They glaze over, they don't hear you anymore. Numbers, 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 they're not hearing you. But they do hear the voice of their patients. So that when I walk in and I say, this is what it felt like, this is what was going through my mind, this was my reaction to the way I was treated. It moves the information from the head to the heart. And that's what we really try to do. When trying to get your staff engaged, one of the best things that you can do is move that information from the head to the heart. Help them engage. Help them to see, what does this have to do with me and my work? Now, this is from an organization where they had just spent millions of dollars putting together a new senior residence area, and it had gotten a lot of press. And so I called the organization as a general consumer and said, I was reading in the State Journal that you have this new senior housing complex, and I'm interested in finding out more. Could you connect me? Well, no, I usually mess it up. Instead of saying, sometimes we have difficulty making those transfers, here's the number. Okay, this one, I swear to you 3 times, very friendly, not helpful. I usually mess it up. I'll give it a shot. But I usually lose people. Good luck. Good. She said good luck 3 times, and I told their CEO, one of the most friendly people I've ever talked to, but not real helpful. And she did indeed live up to her own expectations. What about what I'm asking you to do is bad for our patients? What about this is bad for our patients? I've never gotten an answer that says, here's what's bad, right? When you're dealing with caregivers, remember, they got into this business because they really care about people. You have to speak to them where they live. You have to speak at their level, which is, how does this help our patients? Or what is bad about this for our patients? And let them think about that. Because I really believe that we have people working with us that have serving hearts. And you need to bring them back to get in touch with that serving heart.